For decades, there's been a raging debate over drugs, drug policy, but the use of illegal drugs has remained pretty constant. According to the 2020 National Survey on Drug Use and Health, which is published in 2021, 55.8 million adults reported using some form of illegal drugs. Marijuana, which is federally illegal, was the most popular, but according to the survey, millions of people reported using cocaine, prescription painkillers, and methamphetamines. There's a vibrant debate going on in this country right now over drugs and drug policies. In some cities and states, policies are changing, laws are morphing. Connotations and stigmas persist in some cases, but my next guest argues that should not be the case. Dr. Hart is a neuroscientist, professor at Columbia University, and author of the new book, Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear. Professor Hart, you in the open say this, quote, "I'm an unapologetic drug user. I take drugs as part of my pursuit of happiness, and they work. I am a happier and better person because of them." Which drugs?
I'm sorry, which drugs? I study all of these drugs, and I've tried a large number of drugs. So when you say which drugs, the drugs that people use for recreation, ranging from MDMA to cocaine to alcohol to marijuana.
And it might surprise people. The reason I ask you to say it is because people think, oh, he's talking about, taking an edible. But no, in this book, you're pretty serious saying people have it all wrong in many cases, and you go into a lot of the data as a neuroscientist. So let's just get to the policy portion here. You say the war on drugs is misguided. It's a $35 billion endeavor. And you say the real goal is to, quote, shore up the budgets of law enforcement and prison authorities, as well as such parasitic organizations as drug treatment centers and urine drug testing outfits. Or at least it was at its inception. So you're advocating not just for decriminalization of drugs, is my understanding, but full legalization.
Yeah, so when we think about, it's important for your audience to understand the difference between decriminalization and legal regulation. So decriminalization is basically, we say that we won't be arresting people for personal use of drugs. The state of Oregon has decriminalized all drugs. Sales of drugs remain illegal under decriminalization. But drug regulation is what we do with alcohol and tobacco. One of the problems with decriminalization is that it doesn't do anything to ensure that there is quality control of the substances that people get. And so sometimes people can get tainted drugs, as we know with some of the opioid supply in the U.S. They're tainted with fentanyl or drugs that are more potent, and the user is unaware of the quality of the drug or what may be contained in that drug. And sometimes what's contained in those drugs may be dangerous. And so drug legal regulation will add quality control, just like with alcohol.
A lot of people hear that and go, what are you talking about? Everyone's going to be addicted, strung out, laying in the street. But as you go through your book, you kind of have this fundamental position, some of it based on science that you've conducted in your own lab, to say that not everybody would necessarily become an addict. Like, for instance, if they take heroin, we think you take it, you're going to die, basically. And you say that's not necessarily the case.
Yeah, when we think about a drug like heroin, it's important for the American audience to understand that heroin is legally used in a number of countries. Like right now, I'm talking to you from Switzerland. Heroin is a medication that's prescribed. It's nearly identical to morphine. In fact, morphine is made from heroin is made from modifying the morphine compound. If people knew the dose and the drug that they get, and understand some basics, it decreases the likelihood of negative or toxic effects. And what I'm arguing in the book is just education, increased knowledge, so we have quality control.
Does that make it wise, policy-wise, though? Like if I were to say a certain level of lead ingestion is going to be okay, is it wise to then tell someone, go ahead and do it? It doesn't seem smart.
Great question. So when we think about drugs from that perspective, we think about something like, I don't know, MDMA, cocaine, whatever drug you're talking about, the potential positive effects. Many Americans enjoy those drugs and have a good time. They go to work, they take care of their families, they pay their bills. The vast majority of users of any drug never become addicted, never have these problems. The evidence has been clear about this sort of thing. So when we think about, is it smart or is it wise? It's not really up to me to make that decision. People have already made that decision.
But isn't that why we have regulators and lawmakers, though?
Yes. When we think about drugs and drug policy, many Americans think that drugs are banned because of some inherent danger or because of their pharmacology. It just simply isn't true. We have banned these drugs because of our racism and classism. When we think about a drug like cocaine, it was banned because of stories, untrue stories about black men, for example. When they take cocaine, it was said that they develop superhuman strength. They are unaffected by 32 caliber bullets. They become more murderous. All of that contributed to the banning of the cocaine. And then when we think about the fact that we arrest every year in this country 1.5 million Americans, mainly just for possessing these drugs, the negative aspects of our current policies are far outweighing the benefits of those policies.
Opioids. You walk a really fine line in this book of trying to look at the cold hard data and then also people's experiences. You write on page 35, quote, "Addiction to opioids is far less common than the scare stories suggest. We have been inundated with cherry-picked accounts that portray sympathetic white opioid addicts who developed addiction through no fault of their own. In reality, less than 1/3 of heroin users and less than 1/10 of people prescribed opioids for pain will become addicted." If you consider the fullness of people prescribed that amounts to millions of people, Professor. And that's a hard sentence to read for a lot of people. Have you had any loved ones become addicted?
Of course. I've also had loved ones who have died from what was termed a drug-related overdose death. And like I said, what they actually probably died from is ignorance, combining substances or sedatives without realizing that you shouldn't do that, or also from getting contaminated drug. So when we think about, let's just think about this. Every year in the United States, 40,000 Americans lose their life as a result of an automobile accident. No one is saying that we should ban cars. What we say is that we have to check the speed limits. We want to make sure people wear seat belts. We want to make sure people have the skills to be driving an automobile. I'm arguing that we should take a similar approach with drugs.
Professor Carl Hart, the book, Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear. I appreciate you being so transparent in the book and also pulling together a lot of data that a lot of us had no idea was out there. It's a really, really interesting read. Thanks.
Thank you for having me. I'm an adult. That's what adults do. Be transparent.